Hi there, so this video today is for anyone that's suffering with shin splints or pain in the front of your leg. Something that in the clinic quite often see with runners, if you suddenly increase your mileage or just got a bit harder, or from sort of repetitive jumping and landing on your heels and feet. So the main muscle we're going to be treating is the tibialis anterior. It originates just up here, attaches down along the tibia, and then comes across and inserts in the foot just here. So it can be quite tender, and it's important to really warm the area first. One thing just to note, that if you are experiencing any really severe pain, or the pain's getting much worse and increasingly worse, please do go and just see your GP, because it is possible that you can have a stress fracture in the tibia. So it's worth checking out if you find that it's quite severe. Okay, so to start with, I'm just gonna get a little bit of wax. Use anything you've got, you can use any kind of oil. And we're just gonna start by warming the area. Just some nice long strokes. Warm it up so we can get in there a bit deeper. Just coming right along that tibialis anterior. Making sure you're coming over the foot. And then we can sink off as well. So I'm coming onto the shin bone and just sinking off the side. Right down into that foot, give it a bit of mobility. Okay, when that feels like it's warmed up a bit and not too painful, like we can get in there, we're going to come a little bit more specific. So what we're going to do is we're going to use our bottom thumb for the pressure, but we're going to use, to be more specific, sorry, and we're going to use our top hand for the pressure. So pop your thumb just below that knee bone there, the top of your tibia, sorry. Pop your hand on top, so the pressure's coming from here, and then just push down into the thumb and slide it nice and slowly along the length of the tibia. So you don't have to do the whole thing at once, you could just come and do the top bit for a bit until that feels like it's eased off a bit. Come to the midsection. You can vary your speed and pressure, just see how it feels for you. I always prefer to go a bit deeper and a bit slower, but it's nice to do a bit more lighter, faster stuff as well, just to warm it and get in there. And that bottom bit as well. Right down into the ankle here, and make sure we're getting across that foot and into the insertion there as well. And then it's important, because the tibialis anterior attaches all the way along the tibia here, we really want to just make sure we're loosening through everywhere where it's attaching. It could be pulling into the bone there. So again, same thing, hand on top of the thumb or thumb on top of the thumb, and just pressing down, and then we're working transversely across the muscle. And you want to do that along the full length of the muscle as well here. Okay, so once you've done that, you feel like you've eased off a little bit, we can do a little bit of trigger point work. So what we're going to do is we're just going to find where you found that you have some tight spots. I've got one just there, so I'm going to apply my thumb down into it. Use the other one for support, press down. I'm just going to take some nice deep breaths in. Maintain the pressure, waiting for it to release. You can lift your foot up if you want to. Which just shortens the muscle and can make it a little bit easier to get in there as well if it's a bit painful. So pressure, nice deep breath in. And just wait for that pain to start disappearing, lowering. When that happens, just move on and work through all the tender points within the muscle along there. Okay, next we want to come and work across the top of the foot. So we want to really make sure we're getting where the muscle comes and crosses the foot. So we're just going to do a little bit of release work here. Coming down into the insertion. So I'm just sort of crisscrossing my thumbs and just getting a bit of extra movement through there. And again, do that for as long as you feel you need it. And then I'm going to show you a little stretch we can do. So again, we want to work the whole length of the muscle, and you can put more focus into where you have the tight spots, but I'm just going to show you working all the way along. So what I'm going to do is I'm going to start down the bottom here. So I'm coming just off my tibia, just to the side. I'm applying a little bit of pressure. So again, I'm using my top hand to apply deeper pressure, bottom one to be more specific. Press downwards, and what I'm going to do is I'm going to slide, maintain that pressure up the length of this muscle. And whilst I'm doing that, I'm going to take my foot down and across. So I'm lengthening the muscle, and this way I'm creating even more length by pulling up away from that stretch. So down and move upwards and slowly take that foot down and across. And going from here, pressure in, down and across. And here, down, the foot, across and up with the hands. Mine feels tight at the top here. Press in, slide up, down and across. Okay, then just to finish off, we're going to do a little bit of strength work, activation of the muscle to make sure that it's not sort of misfiring and it's doing what we want it to do. It should also calm down any tension and pain within the muscle. So what you can do is you can just take your hands and pop them on top of your foot, or you've got a band, you can do it with a band. So either way, apply a bit of pressure down this way. And all you're going to do is you're going to draw your foot upwards and press up into the tension. So I'll do it with my hand just so it's a bit more obvious what I'm doing. So I'm just going to pull up, hold it there for about 10 seconds and release. And again, so pulling upwards. So you can see my muscles switching on. I'm choosing when it's firing. I'm holding that pressure, activating, strengthening, switching off any misfiring patterns, and release. And again, you can do that as many times as you feel you need. That is massage for shin splints. Thanks.